Hey everyone, welcome to The Explainer. Today, we're diving into a topic that honestly carries way too much unnecessary stigma, but we are going to look at it completely differently. We're talking about erectile dysfunction, or ED. But instead of viewing this as some kind of source of shame or personal failure, scratch that. We need to completely reframe it. We are going to start looking at ED as an absolutely crucial physiological warning sign.
Let's put a really important number into perspective right out of the gate. 50. You know, about half of men in their 50s experience erectile dysfunction. Half. That means if you look around a crowded room of guys in their 50s, literally half of them know exactly what you're going through. So, right off the bat, if you or your partner are dealing with this, you are absolutely not alone. It's incredibly common, and honestly, normalizing this is the very first step to actually doing something about it.
So, when this happens, what is your body actually trying to tell you? Well, medical experts strongly suggest treating ED like the check engine light on your car's dashboard. Think about it. When that light comes on, you don't just ignore it, and you definitely don't feel embarrassed by it, right? You look under the hood. ED is frequently the very first sign of underlying systemic health conditions that desperately need your attention.
Here's our roadmap for today's explainer. We're going to start with the body's warning signal. Then we'll move into fixing the foundation. After that, we'll open up the treatment toolbox, shift gears over to the partner's perspective, and finally, wrap up with redefining true intimacy.
All right, part 1, the body's warning signal. You see, penile health is directly linked to your overall cardiovascular health. It's all connected. When a doctor hears about ED, they immediately think about checking for cardiovascular disease, diabetes, high blood pressure, and high cholesterol. Now, why is that? Well, notice how incredibly small the blood vessels are in that area. Because they are so tiny, they can become blocked or damaged by these chronic systemic conditions way before the much larger vessels near your heart do. So it acts as this incredible early warning system for your entire body.
Moving on to part 2, fixing the foundation.
So if the problem is largely about blood vessels, the solution has to start right there too. You have to address smoking, improve your sleep quality, manage your stress, increase cardiovascular exercise, and limit alcohol intake. And let's really think about why this matters. Poor sleep and high stress, they trigger cortisol and sympathetic nervous system responses that literally constrict your blood vessels. Smoking, it actively damages the lining of those vessels. On the flip side, anything that gets your heart pumping and improves your cardiovascular fitness expands them and improves blood flow everywhere in your body. Doing this sets you up for a healthier penis that is far more likely to work better entirely on its own.
Now, the absolutely crucial point here is that medical drugs are often just a temporary fix for performance. They aren't magical time machines, you know? While we can't always reverse the clock and restore your body to exactly how it was at age 21, improving your blood vessels through those foundational lifestyle changes creates a much healthier physical foundation. Think of it like treating the roots of a dying tree, rather than just taping on a few green leaves and calling it good. It is the absolute baseline of care.
All right, let's dive into part 3, the treatment toolbox.
Let's look at the exact mechanism of how a thought actually becomes a physical erection. It's pretty fascinating. First, the brain sends, let's call them sexy signals, down the spinal cord based on your interest and stimulation. Second, a chemical called nitric oxide is released into the body. And third, that nitric oxide tells the blood vessels to dilate, allowing blood to rush in and create the erection. Understanding this specific sequence is absolutely vital because it shows us exactly where our medical treatments actually intervene. And that brings us to our first tool, PDE5 inhibitors. These are medications like tadalafil or sildenafil. They're the first-line, highly effective, and now very inexpensive treatments you've probably heard of. What they do is simple, but totally powerful. They basically amplify the nitric oxide signal the brain is sending. Think of it like turning up the volume knob on a radio. The signal is already there, it's just getting a massive boost. But remember, because they amplify an existing signal, they rely entirely on that first step, the brain actually sending the signal happening first.
And knowing that helps us bust a massive myth about these little blue pills. The myth is that taking one causes an instant, spontaneous erection, regardless of what you're doing, like even if you're just sitting at the kitchen table doing your income taxes. But the reality? Because it only amplifies the physical response to nitric oxide, it absolutely still requires active sexual stimulation and interest. You are not going to get an erection doing your taxes, unfortunately. Or, well, maybe fortunately.
Now, another really common fear with these pills is something called priapism, which is a painful, prolonged erection lasting more than 4 hours that won't go down without medical intervention.
It's a scary piece of medical jargon for sure, and it's slapped on every single warning label. However, the clinical data actually shows that this is a super rare risk with standard pills, and it's actually much more associated with our next category of treatments, injectable medications.
So let's zoom out and look at the full menu of options. If pills fail, or if they just aren't right for you, you aren't out of options. Not at all. Injectables deliver medication directly and work regardless of stimulation, though, like we just said, they carry that slightly higher risk of priapism. Then you have devices, like vacuum pumps, which physically pull blood in. They're completely non-invasive, but they can be a bit cumbersome in the moment. And finally, a penile prosthesis acts as a surgical inner tube for a permanent fix, though obviously that requires surgery. The main takeaway here? There are highly effective, very safe options for almost everyone when guided by a specialist. We should also briefly touch on the absolute cutting edge here, regenerative therapies. These aim to improve penile tissue health directly at the source. This includes low-intensity shockwave therapy to promote tissue growth, platelet-rich plasma, or PRP, and even stem cell therapies. But a quick word of caution here. While shockwave therapy does have some solid data for moderate ED, many of these, especially stem cells, are either still highly experimental, lack prime-time clinical data, or should really only be done within rigorously controlled clinical trials.
Okay, part 4, the partner's perspective. I want to slow down here for just a moment because the physical mechanics, well, they're only half the story. If you are the partner watching this explainer, I am speaking directly to you right now. As Dr. Ashley Winter notes in our source material, if a partner breaks a leg and needs crutches, you don't take it personally, right? You don't feel rejected by their broken bone. But with ED, partners so often mistakenly feel unloved. They internalize the physical symptom as a sign that they are no longer attractive. We really have to acknowledge that deep emotional pain and the self-esteem issues that pop up, while also recognizing that it is a profound misunderstanding of what is physically happening in the body. Take this incredibly clear medical example. Prostate cancer surgery. Sometimes, this surgery can cause unavoidable injury to the microscopic nerves connected to the penis, resulting in sudden, immediate ED. This medical reality emphatically proves that the loss of an erection is strictly an anatomical, physical issue. It has absolutely nothing to do with a loss of love or a loss of physical attraction towards you. Truly understanding this is absolutely crucial for healing the relationship.
Which brings us to our final section, Part 5. Redefining true intimacy.
Treating ED isn't just about getting a physical mechanism to work again. It's about empowering couples to embrace a truly holistic view of their sex life together. Honestly, by simply expanding your playbook, couples can actually have the absolute best sex life they've ever had. By taking the intense pressure off of achieving a rigid erection, couples can focus heavily on deeper connection. We're talking about engaging in more erotic touch, focusing on the partner's pleasure, exploring mutual masturbation, and really just remembering what intimacy felt like as teenagers. Hours of kissing, hugging, and connection without the strict expectation of penetration.
I want to anchor all of this with a super powerful quote directly from Dr. Winter. The loss of the erection is not the loss of intimacy. This is such a massive, important distinction. Couples must communicate openly about this. Bring your spouse into the clinician's office. Take on this journey together as a team, because intimacy is a shared experience, not just a biological function.
So I'm going to leave you with this final thought. Will you let stigma keep the door closed, or will you redefine intimacy and take control of your health today? Don't let embarrassment stop you from checking that engine light. Speak up to your doctor, share this with your partner, and take the very first step toward better physical health and a much deeper connection. Thank you so much for joining me on this explainer, and keep exploring, keep learning, and keep taking charge of your well-being.